They're helping Pay It Forward. Project BDG was developed to help those in need receive dental care. They're hoping to change the community one patient at a time.
Here with more is Dr. Jared Utley, along with Project BDG board member and hygienist Christy Thomas. Good morning to you both.
Welcome.
Good morning.
Thank you.
All right, so Dr. Utley, let's start with you. Just give us a little overview of what Project BDG is all about.
So Project BDG is about giving back to the community. So BDG stands for Broadening Dental Generosity. And so we want to be able to give back to those underserved in the community that have dental needs.
Okay.
And when did you start this program?
This program started a year ago, so we've been up and running for a year, and what we do is we give back once a month to the community. We have a dental service that's set up to be able to help the patients that are in need.
So people come into your office during this time period, or where does it happen?
So we have a central location that's off of Sahara, where we have the clinic on a Sunday. So once a month on a Sunday, the patients come into the clinic and we're able to help them out.
Great. And Christy, what services do you provide?
So I'm the dental hygienist and I clean teeth, but at the event we extract teeth, we provide cleanings and basic fillings.
And this is at a low cost, free to patients, or a sliding scale, or how does it work?
It's no cost. Project BDG is to serve the underserved, so that's patients with no insurance whatsoever.
Wow.
And so there's no fee at all.
Wow.
And to do this and to open up your office on a Sunday when most people like to be at home with their family, it's so generous of you to do that. That's really incredible. Now, since you've opened up about a year ago, how many patients have you seen?
We've seen 200 to 300 patients. We try to get groups of 40 to 50, and we do a half a day so the people that are volunteering aren't spending their whole Sunday working, but a half a day to get patients in and get them taken care of, get them out of pain.
And how many staff are involved? How many staff do you have?
It varies. What we do is we try to get staff to volunteer, and so we put it out there for anybody that wants to volunteer to be able to volunteer, anywhere from 1 to 2 doctors, 1 to 2 hygienists, and then 10 to 15 support staff to be able to come in.
Okay, so all kidding aside, both my father and brother are dentists. So if they're visiting, is there a way that they could get involved theoretically, or is it only for local
So that's
dentists?
set up on the website. So projectbdg.com, there's a way to be able to volunteer for dental professionals.
Wow.
And then also we're looking for non-profit organizations or shelters for at-risk teens or the elderly that don't have any way to access dental care, to be able to go online and say, hey, we have this need, and we can contact them back and be able to set up an opportunity to be able to serve that need.
I'm going to get my pops on this. Honestly, he does some things with Project Smile and everything. It's such a great thing you're doing. Where did the inspiration come from?
It's really this, you want to answer that one? I feel like I'm talking a lot.
Well,
Take it, Christy.
Well, our desire is to serve our community one patient at a time, giving back and paying it forward. We would like to have our community become a community where I help you, and then you in turn go out and help someone else.
You're paying it forward
Paying it
by
forward.
contributing to society and helping someone else.
Yes.
And it's got to make you feel so good to help these people who, in some cases, I'm sure has not gone to see the dentist in years.
And sometimes never.
Wow.
Yeah, and what are the consequences of not seeing a dentist? A lot of people go every 6 months. You know, they do their regular visits, but what happens to people when they don't get oral care?
Things always get worse. I mean, you have a little filling, and the little filling that could be stopped with a filling turns into a tooth that needs a root canal. If that doesn't get taken care of with the pain, the tooth needs to be extracted. Right. And so things grow if you're not seeing a dentist regularly.
Yeah.
Dr. Utley, what are the requirements of patients to see? Are there any at all?
The only requirement we have is no dental insurance, because if you have dental insurance, we want you to see the normal clinic that you can go to. And the other one is that you pay it forward. If we provide a service to you, we want you to be able to go forward, determine what you think the value of that is, the service that was rendered, and be able to help 3 other people. And that's the requirement.
Yeah.
Wow,
Very,
that's great.
very
Well, thank
cool
you very
project.
much. Thank you for being here.
Thank you for having
All right,
us.
again, Project BDG was developed to provide dental care of those in need. They're located between South Rainbow and Buffalo Drive on West Cliff. If you'd like to volunteer or learn more, just visit the website or call the number on your screen.